Hi, my name's Emily and I'm here with...
My name is Yvonne Dietrich and I work in Truly in Bray.
And we're going to be talking about our full arch implant prices. So, how are we changing the full arch implant prices at Truly?
Right now we just have one set of prices. We have one plan for everyone, but that's not right for everyone. Some people can't access it, and other people have more money to spend. Also, it's not like one shoe fits all. Everyone, and we have to tailor make our packages, for a better word, to suit kind of a wider range of people. And we've also found people are coming from all over the country, and some people really, we have to kind of factor in those things as well. But it's just, we want to be better at it, and we're very competitive, we know that. But also some people want more, and they want the end product to be better and to look more natural, really. That's mostly it.
So how do I pick between Truly, Basic, Advanced and Premium for full arch implants?
It depends, first of all, what kind of person you are. First, do you need sedation? Will IV sedation work? Will oral sedation work? Or are you maybe extremely nervous? Is the surgery more extreme and more severe for you? Do you need general anesthetic? Where do you live? Possibly the overnight stay might be a really good option with our premium package. The next most important thing is your finances. It's what you have to spend and also what you want to spend. Are you very, very vain? Are you very, very fussy? And you're not going to get the most natural set of teeth with our basic package. You're not going to get the little lines that the ceramicist is designing and painting and wear facets and maybe a chip here or something there and like little veins in the gum and stuff. All the time and effort that are put into the final set of teeth that you might not get with the basic package, because just what the teeth are made of, you're getting what you pay for, really.
Yeah. So what's included in the Truly Basic package for implants?
The basic package includes 4 implants. It includes a set of temps with up to 1 adjustment, because we don't always get it right. We might not get the midline right, we might not get the level of your smile right, and we might need a few adjustments here and there, but it is only 1 adjustment to temps. If you break your temps, unfortunately, you have to pay for them. It means we know you were eating. Your extractions also aren't included, and that's a cost that people need to think about. Obviously, every case is different. If you might not have any teeth to start, if you're wearing dentures, you might only be a couple of teeth, then it's not really a big deal. But if you've got 20 teeth, and that's 20 by whatever cost of every extraction, that adds up, and that's important to factor into it. Your night guard's not included, sedation isn't included. Now, sedation can be added on if necessary. IV sedation, general anaesthetic is absolutely not included, and it would be a huge cost to add it on. Then your zirconia, your monolithic, your permanents or monolithic zirconia, they're going to be lovely, they're going to be the right colour, the gums will look nice, but they won't be as shiny, they won't be as individual as some of the other packages might be. You see it on our website all the time. Upfront payments, which is a huge part of our business, is if you pay up front, you get 10% discount. With a basic package, you don't. The package, it is what it says on the tin. The cost is the cost. By you paying up front, you're not going to get the 10% discount you may get with other big treatments.
So how much is the Truly Basic package?
The basic package, it's €8,500 for a single arch, and then it's $15,000 for a double arch, top and bottom.
So what's included in the Truly Advanced package for implants?
First of all, you are entitled to your IV sedation. It's 4 to 6 implants as needed. If you only need 4, great, but if we have space and real estate to put more, and if there's a problem with one, we've something else to use in the future. So 6 implants, up to 6 implants is included. The temporary teeth, you can have 2 adjustments. So in some cases, I'm really not happy with these ones. Can I just have 1 more before we go to finals? I just want to change this. There's a little bit more smile design. There's a little bit more, we can make them a little bit more personal. And as to the finals, they're ceramic with, they're zirconia with an overlay ceramic. And they are a little bit nicer, a little bit like a vein painted in the gum, a little bit of a facet, a little bit of a line in the ceramic. More, and if you have before photos, I did a case recently where the lady is in her teeth that she got married in. Like, her real teeth look like the same. She found a really old photo and I was like, oh my God, are you serious? And our designer was able to make her temps look like her teeth was before. So there's a little bit more of that. There's a little bit more more interaction between you and the dentist, and also then you can have direct contact with the ceramicist, the actual person, the technician who makes the permanent teeth. They'll pick the colour. The gum shade is one I'm struggling with, where I've spent my life picking colours of teeth. Now I'm expected to pick what shade pink you are, and are you veiny, or do you have, some people will have freckles and they'll have different marks and stuff, whereas you're going to get more of that. Your extractions are included, which is important. As I said, that can all add up. Also, you get a night guard. The 10% discount for upfront payments is also included in our advance package.
Why is it important not to eat with full arch temps?
Implants need time. They need time to become part of you. They need time to integrate. And so it's about the healing of the implants. But it's also, these are temporary. They're only there for a short period of time. It's not that you're not eating, you're eating a liquid diet for the first 4 weeks, then you're moving to a soft diet. That's a diet, that's food you can kind of smush with a fork, food that you don't actually have to articulate your teeth. They're a softer material. They're not ceramic. They're made from like a composite-like material, and they break, and it costs a lot to make a new set. Like if you break your temps, if we can use the old design, we can cut down some of our lab costs, but a set of temps costs, upper and lower temps can cost €890. So if you break them, you have to pay for them, and we know you're eating if you break them.
We know. It's no hiding.
And also, if your teeth become loose, we know you're eating. I know you're eating. If you weren't eating, if you're wearing your night guard and you're not grinding, then how are the screws becoming loose? Because you're eating. Because you're putting too much pressure and you're like sawing. And also, I also say your night guards are so important. Money's hard come by. We work really hard to get it. Unless you have a money tree in the back garden, you have to protect your investment. You have to do what we tell you. And there's a reason we tell you. We have the science to back it up. We're not doing it for the laugh. We're doing it to make it the best that it can possibly be.
Yeah.
Clean them. Do listen to us, please.
Yeah.
Please.
So what's the price of the Truly Advanced package?
A double arch is €19,500 and a single arch is €11,500.
If you have someone coming in for, say, the advanced package, but then you look at their bone and you're like, you really need a zygomatic.
Yeah, but there's no reason why it still can't be me, because Jimmy will put the zygomatics in for me, or he'll be there on the day. It's easy for me because he's there beside me.
Will that change the price then?
Well, yeah, like for example, I have a lady who was a dentist, so she had no teeth coming to me. She lives somewhere, I think she's Donegal or somewhere miles away. And she has dentures, upper and lower dentures. And we're like, look, we're going to try the upper. There's very little bone on the bottom. We're going to see how it goes. We actually managed to get 4 implants in, but Jimmy was there and we had thought we'd have to get zygomatics. And we were like, look, we're going to charge you. If we can get 4, this is the price. But if we're not happy, or if there's a problem with any one of the 4 going forward, we have to put zygomatics in, and we're going to charge you additionally for those specific, because I can't put a zygomatic in. I haven't got enough training. There's really only, as far as I know, Jimmy and Mo who can do it. So, Sad probably can too, but it's so specialized, and it's also, it's just more advanced, and you have to pay for that knowledge, and you have to pay just for that additional surgery.
Yeah. What's included in the Truly Premium implant package?
Okay, first of all, it's 6 implants plus, including zygomatics and pterygoids for those customers and patients who just don't have the bone. They don't have the bone anteriorly, so we have to find it, and we find it to the back of the mouth, up at the back of where your teeth, where your teeth end. And again, more specialist treatment, more specialized dentists, surgeons who are doing that. It includes general anesthetic and an overnight stay in our hospital. If you want IV, that can be possible too. Some people don't need general anesthetic. They don't need an overnight. You can probably have IV and an overnight if you want. But we tailor each package to every person, every individual, and every case. Some cases are complex and some cases are really straightforward. The other thing, that you can have 3 adjustments. So you can have 3 sets of temps. I really don't like this color, I want a different color, things like that. And you get the more individual package where you get to meet the technician, and like they'll help choose the color of the gum, things like that. The final teeth are a whole other ball game. They are instead of the other packages where we just print the teeth all as one, these are printed on a substructure, and then the ceramic Emax crowns are actually individually cemented onto the full arch and individually painted and just like beautiful, like as natural as if they were a set of crowns fitted into somebody's teeth. They're beautiful, and they're going to look what you want them to look like. You get to say with more than just the dentist. Here's a set. Here's your teeth. They're lovely. They're better than what you had before. Whereas these are your teeth, and they're guaranteed for life. They're forever. This package comes with a lifetime guarantee, whereas the basic and the advanced package, it's a 20-year guarantee. Things like sinus lifts are included in the premium package. Your night guards are included. Sinus lifts are important because some people just really don't have enough, especially if they've lost their teeth over a long period of time. And most people are coming to us where they've a couple of teeth at the front and they've lost their premolars. And what's above your premolar is your sinuses, above your first molar. And if you've lost the molar, you lose the bone. And a sinus lift, it's a complex procedure. We have to use grafting materials. And it's again very specialised, and the sinus lift can cost €2,000 to €3,000. So it's included in our premium package. It's also included in our advanced package if it's necessary. The cost for a premium package is €18,500 for a single arch and 28 for a double arch, top and bottom. With the basic package, obviously we make the teeth for you, but we don't get into it as much as we do with the other cases. It's about you're paying for it, so we're going to spend more time at it. I personally would ask people, have you got a photo? I ask lots of people, like, I don't want a photo from when you were 12, but like, have you a really nice photo of you smiling? What kind of shape do you want? Like, I know certain people went, I want your teeth. And like, there's a certain singer that went around with the exact same teeth as me because she liked the shape of my teeth. And you know what I mean? And what looks right on you? What I think looks right on you might not be what you think. So with the more advanced and premium packages, you're going to get more of that interaction. The temporary teeth are soft enough that we can adjust them. We can do little things. We can fix bites. We can go, oh God, that canine's a bit pointy for your age. No one has a pointy canine when they're in their 50s. We grind them down over years. So you get a lot more design features. It's like when you're buying a car, am I adding alloys? I'm hopefully getting a new car. Am I adding tinted windows? Am I getting like pearlescent paint? It's exactly the same. It's like your basic package, and then you can, it's add-ons.
Yeah.
And the more you pay, the more you're going to add on, the more you're going to get.
So, what's a testimonial, and what would be my incentive for doing one?
Well, first of all, a testimonial, you will get a night guard. You will get your 6-month review free with the advanced and the premium package. But it's also, if you've had a successful outcome, why would you not want to tell everybody? You've so many, we've changed, like we are actually genuinely changing people's lives. Especially someone who's had dentures, who hasn't been confident to smile. You know what I mean? We're changing, and we'd like you to help us get the word out. And give us a little bit of your background. Maybe had you got a history, had you a bad experience when you were younger, or had you not necessarily, lots of people just don't have access to dentists. Lots of people are traveling to come and see us because not everybody does what we do. And if we want you to help us just get it out there, tell us. Just give us a little quick video. Even do it yourself. We've a lovely one going around at the minute where one of the girls, her sister, just happened to do a little video and sent it to her sister, and it's so natural. We want, it's so nice because people are so quick to complain. It's nice to hear the good stuff, and people like hearing good stories.
Yeah. It helps other people as well.
It does. I mean, it also, little things like, oh, were you sore? Of course you were sore a little bit. I had a lady, I did a full arch on Monday. She said she didn't take any painkillers. I was like, what? How? I don't understand. Most of our patients are genuinely, they're fab. They're like, and it's a big decision. You don't come by this lightly, and it's massive surgery for lots of people. And like, I'd imagine I'd be frightened. Only I know how some people find it easy. Okay, some people don't find it easy. It's very hard for them. But it's nice to get all the stories, even some of the bad stories. It helps us learn as well. And give us a bit of feedback. We like it. It's how we get better.
Yeah. What's the difference between IV sedation and general anesthesia?
Okay, IV sedation is something right now that I do. That most of our dentists that are providing these surgeries will do. We will bring you in, we'll put a cannula in your arm, we'll give you, it's midazolam usually that we are giving you, and we'll start you off slowly, we'll hook you up to a blood pressure monitor, and it's controlled. We keeping an eye on your blood pressure, we're keeping an eye on your oxygen saturation, and it's like we give you a small dose up to a certain limit depending on the person. We keep an eye on you. Now it's conscious sedation. You are awake. You need to follow instructions. Take a big deep breath, open your mouth. You're not asleep. We don't want anyone snoring. We're like, come on, wake up, wake up, wake up. We don't want any of that. And you are fit and able. Obviously you need a bit of help. You need an escort. Someone comes with you, someone brings you home, someone stays with you overnight, because that's important. That also if people are traveling, either are you staying up here, who's with you, all of these details that we'll find out beforehand. General anaesthetic, or GA as we keep saying, is a whole other ballgame. That's not provided by dentists. That's provided by an additional person. That's a doctor, an anaesthetist. They're an individual person apart from the person that's actually performing the surgery. Whereas if I'm doing a surgery, I'm doing your surgery. I'm the one who's giving you your sedation. I'm the one in charge of you. I'm monitoring your stats. Whereas general anaesthetic, it has to be done in a hospital environment. You're hooked up to an oxygen machine. You are sedated. You're asleep. Yeah. With both cases, and which is great about IV sedation, most patients, they don't remember it. Now some do, unfortunately, but most of our patients, they'll remember coming in. They won't remember anything in the middle, which it's a good thing too. General anaesthetic's the same. Obviously you're not conscious, whereas with IV sedation, you are conscious. You are awake.
Yeah. I mean, I've had IV sedation before, and
awesome.
I feel like I blinked and 45 minutes had gone by. Do you know? It's like I was there, but I really wasn't there.
And it's funny because different people are different. Some people, you'll give them the smallest. I'll always start them off on 0.5 mil, and they'll literally I'm like, oh my God, wake up. And they're snoring. But whereas other people, it takes them a little bit, but also people's anxiety. If people are anxious, it takes them a minute, it takes a little bit more, and then you can kind of keep them at a level with an awful lot less. Yeah. So it's very, very different. Everyone's different. The other thing with IV is you come around a lot quicker, because we'll stop giving it to you because we need you to get up and we need you to be able to either go down the stairs and get into your car or whatever. Whereas with general anaesthetic, and that's only included in our premium package, you're an overnight stay. You have to come fully around. You have to answer a series of questions. But that's somebody else is looking after you. The dentist is not there.
You won't be driving the car.
No. And equally so, you'll stay overnight if you need to. If you don't need to stay overnight, so people with GA can go home after a certain period of time if they're coming around, if their body's expelling the anaesthetic. You know what I mean?
What's the first step booking in?
We have these wonderful people called treatment plan coordinators, and their job is to give you information. So what you can do is you can do it online, you can call any of our phone numbers, you can call into any of our clinics, and you can book an appointment with our treatment plan coordinator. And what they do, this appointment is free, you don't have to pay for it. They will chat to you, get a bit of history, give you a bit of information, give you an idea, a range of finances, costs, and they will, from their conversations and from your information, they will channel you to the surgeons, to the dentists that provide the treatment. Where do you live? How did you get here? Where's close to parking? You know what I mean? Things, everyone's different. Also, some of our treatment plan coordinators are doing their consults virtually. So one of my patients lives in Letterkenny. She was coming home on a flight, so she popped into our Bray branch, met our treatment plan coordinator. I happened to be there. Now that doesn't happen very often, but like Yvonne, she's come from Letterkenny. It does happen all the time. Gail is like, Yvonne, please, will you have a quick look? Of course I will. You know what I mean? So, sometimes you can hit two birds with one stone, but the whole point is you go to see them and then they will channel you wherever suits your needs.
Yeah.